I just saw your email. For some reason, I'm not able to mute or unmute you.
Someone muted me. Stop muting everybody. All right, let's see here. All right, just bear with me just 1 second. I'm going to try to get just oriented a little bit here before we start on this new platform. Okay. Again, before we call the meeting to order, so are we, who is the person who's going to be letting people in from the lobby? We just had Nelsie in there. Is that Trudy or?
I've been trying to keep an eye on that.
Okay.
There's another one. She's with the county.
Okay. Okay, so I see Mr. Tolbert, Mr. Tao, Ms. Yang, Ms. Prince. This is the situation here on the sidebar where there's so many people in the presenter side. All right. Okay. Recording's already started, but I just want to let folks know that we are using Microsoft Teams for the first time for our council meeting, and so bear with us as we use this new format. I think we had a little practice this morning. We should be okay, but with that, I'm going to call the meeting of the St. Paul City Council to order. Roll call.
Naker, who is excused. Prince.
Here.
Tao.
Here.
Tolbert.
Here.
Yang. Councilmember Yang.
Here.
Jalali.
Here.
Council President Brenmoen.
Here.
6 present, 1 absent, being Councilmember Naker, who is excused.
Please stand and join me as I lead the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Consent agenda items 3 through 16 are before you for your consideration.
And my understanding is that we are pulling item number 3 for separate consideration. Are there further consent agenda items that should be taken separately? All right, seeing none, Mr. Tao moves the consent agenda. Roll call.
Prince.
Here.
Tao.
Aye.
Tolbert.
Aye, amen.
Yes.
Yang.
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The consent agenda is adopted as amended. Item number 3, Resolution 20-1077, supporting the Minnesota Health Plan and Medicare for All Act.
Ms. Yang. Ms. Yang, are you, if you're speaking, you may be on mute.
Do you hear me now?
Yes, we can.
Thank you. I'm having a lot of trouble with my mic today, so bear with me.
There you are.
So for the resolution here, we do have 2 speakers, but I have a couple of things I do want to say first. The first one is I do want to share with everyone that I have added 2 amendments, including language around, let me pull up my document here, around the Healthcare Emergency Guarantee Act, which provides the universal comprehensive health coverage with zero cost sharing for patients during this pandemic crisis. And we've also included language for the city council to encourage the Minnesota state legislators and congressional delegation to work to pass this act as well.
Great. So would you like to move a version 2 then in Legistar before we go to further comments and a final vote?
Yes.
Okay. So Ms. Yang moves version 2. Roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The amendment is approved.
Ms. Yang.
Thank you, everyone. And I would like to take a moment to read the resolution just so that we can ground everyone before the speakers come on. And so I have so many tabs on my screen. I'm so sorry. This is the life of doing meetings online. But first, before I do that, I wanted to give a huge shout out to the organizations that co-governed and co-crafted this resolution. The Minnesota Nurses Association, Healthcare for All Minnesota, Physicians for a National Healthcare Program, and Democratic Socialists of America. Thank you all so much. It's because of you all that we're able to take this big step in building toward a future that everyone deserves. And I know that there are so many who are part of the movement to win the Minnesota Health Plan, Medicare for All, and Healthcare Emergency Guarantee Act. And I'm really grateful for you all and holding you all in this space as well. So onto the resolution here. Supporting the Minnesota Health Plan and Medicare for All Act, whereas the City of St. Paul is challenged to meet the rising costs of its employee health coverage, whereas 9.1% of the St. Paul residents under age 65 lack health insurance, whereas the uninsured rates of all Minnesotans rose from 4.3% in 2015 to 6.5% in 2017, leaving approximately 349,000 without coverage despite the state's economic recovery. 13.9% who are people of color and American Indians, 11.9% who are people with a high school education or less, 11.3% who are persons with incomes below 200% of the federal poverty guidelines, 10.9% who are young adults ages 18 to 34, whereas 72.1% of Minnesotans without health insurance are employed, whereas Minnesota employers' health insurance costs increase at a faster rate of 5.7% than the 4.3% national average, whereas Minnesota's total healthcare spending will double from $47.1 billion to $94 billion in 10 years to be 19% of our state economy, more than housing and transportation. Whereas the Minnesota Health Plan for a unified healthcare financing system will contain costs and save money to provide high quality, comprehensive healthcare for every Minnesotan. Whereas the Minnesota Health Plan will save local and state government spending on employee health care, whereas U.S. residents and businesses beyond Minnesota would spend less under a federal Medicare for All Act, whereas both conservative and progressive studies estimate a national savings of $2 trillion to $5 trillion over 10 years under the Medicare for All Act, whereas both the Minnesota Health Plan and Medicare for All Act are based on the same principles of a unified healthcare financing system. Therefore, be it resolved, the City of St. Paul affirms that health care is a basic human need, which must be guaranteed to all Minnesota and U.S. residents, and therefore endorses the Minnesota Health Plan, the Medicare for All Act, and the Healthcare Emergency Guarantee Act, which provides universal, comprehensive health coverage with zero cost sharing for patients during this pandemic crisis. Be it further resolved, the City of St. Paul will notify Minnesota state legislators and congressional delegation of its endorsement, and the council members and city officials will encourage them to sign on to the Minnesota Health Plan and Medicare for All Act as co-sponsors and work to pass the Healthcare Emergency Guarantee Act. Thanks, everyone. I'm going to pass it on over to our speakers who are here to give a live public comment.
Ms. Mormon, were you going to facilitate that? I know we had an order of speakers. I believe Stella was going to go first, but I think Ms. Mormon was going to, she has had the callers on the line. Okay. I apologize, but I don't have the names of the speakers. So Nelsie, would you like to introduce them?
The speaker names are, I know we have Stella and Dan.
Okay, so Stella and Dan. Do we know if Stella is in the house? Ms. Mormon.
Council President, we had a little bit of technical difficulty there. Can you hear now?
Yes, I sure can.
Perfect. All right. On the phone line, we have Ms. Stella Obadiah and Mr. Dan Marshall. Ms. Obadiah will speak first.
Welcome, Ms. Obadiah.
Okay. Thank you. Thank you. Good afternoon, members of the council. My name is Stella Obadiah. I'm a registered nurse from Bethesda Hospital. I stand before you in support of the Minnesota Health Plan and Medicare for All resolution. I want to thank you for your continued support to keep Bethesda and St. Joseph's Hospital open for their unique and very necessary healthcare assets in St. Paul. Recently, St. Joe's was named as one of the 2 best hospitals in the Twin Cities for the very reason that management wishes to defund it. Under the current healthcare system, huge healthcare corporations make decisions about where to open or close healthcare facilities based on their bottom line, not on the community's healthcare needs. As a nurse leader at Bethesda, I know firsthand the specialized services provided at Bethesda, 1 out of 2 healthcare hospitals in the Twin Cities area, are critically important. Under the Minnesota Health Plan and Medicare for All, placement of healthcare facilities will be determined through regional planning based on the health needs of the community, not the profit or reserve margin of the corporate healthcare. At the beginning of the COVID-19 pandemic, Bethesda was designated a COVID specialty hospital. It was clear from the start that mHealth Fairview had no preparedness plan to face a global pandemic. That's because they operate on a just-in-time business model, when they should operate on the precautionary principle. We should not wait for scientific proof of harm before taking action to protect people's health. The Minnesota Health Plan and Medicare for All prioritizes planning for potential catastrophes, saving money overall by shunning the current free market system that is now charging $8 for an N95 mask that costs $1 per pandemic. As a nurse of color, working at a hospital that treats our beautifully diverse community, I see firsthand the effect of racial disparity in our society. According to the Ramsey County Community Health Assessment completed by the Health Department, 72% of emergency room visits will be prevented if people have primary care. Up to 1/2 of minority youth do not get needed mental health care. Over 50% of minority pregnant women in the county do not get prenatal care until the 3rd trimester. The life expectancy for community members living in the neighborhoods of Randall, Frogtown, and downtown is over 5 years shorter than those living in the surrounding suburbs, as it were. The pandemic makes these statistics above even worse, as all have seen the practical example of what lack of and inadequate access to primary health care has done to the people in this community because of their morbidity and their comorbidity, all as a result of inability to seek preventive care. Also, because of lack of insurance, they can only access health care via the emergency room, thereby incurring more expenses on the already overburdened health care. Racial health disparities are but one example of structural racism, which in and of itself negatively impacts health. The Minnesota Health Plan and Medicare for All establishes a system that finally allows us to start addressing these horrible racial health disparities. I am a nurse whose practice is centered on patient care, which has been completely lost in our current system. On behalf of the 23,000 nurses of the Minnesota Nurses Association, I urge the Council to pass the resolution supporting the Minnesota Health Plan and Medicare for All. Thank you.
Thank you so much.
Thank you.
Mr. Marshall.
Yeah, hi. Hello, thank you. My name is Dan Marshall. Thank you for the opportunity to speak in support of the Minnesota Health Plan and Medicare for All. Our family owns Mischief Toy Store on Grand Avenue. After 21 years selling toys in St. Paul, we like to think we know a lot about puzzles, but instead of showing off games and toys to our customers, much of our time is spent trying to solve the puzzle of healthcare. With the Trump administration's ongoing attacks on the Affordable Care Act and now the coronavirus pandemic, affording healthcare has become the #1 threat to our family business. Before the Affordable Care Act, our family was paying an extraordinary amount for healthcare. Due to my wife Millie's juvenile diabetes, a pre-existing condition, private insurers refused to cover her. We paid well over $25,000 a year with insurance premiums and high deductibles. Instead of being able to invest in our business, we were barely afloat. After the Affordable Care Act passed, we purchased private insurance through the new exchanges. At first, these were fairly affordable, but the plans grew more costly every year. Later, when our business changed and our income decreased, we qualified for Minnesota Care for several years. But this past year, one of our local competitors closed and our income increased slightly. So we had to purchase a high deductible private insurance plan through MNsure, an increase of over $1,000 per month. Then, of course, the pandemic hit. Our revenue, like almost every other small business in St. Paul, has dropped significantly. Yet we are still burdened with these increased costs based on last year's earnings. Because of our plan's high deductibles, we think twice before seeking care. We learned recently that our kids have also internalized this hesitation when my teenage son, while chopping wood, accidentally hit his thumb. His main concern wasn't for the health of his hand, but the cost to fix it. We actually had to argue with him in order to get him into the ER, where he got 18 stitches. And the puzzle of which plan we will or won't qualify is also extremely frustrating. Every year I spend literally hours on hold with the county health department and MNsure attempting to re-enroll. It always happens during the last 2 months of the year, our busiest season. This past year, due to processing delays at Ramsey County, we received multiple conflicting notices about the status of our insurance. We weren't able to enroll in our MNsure plan until December 30th, a day before the deadline, a task I was forced to accomplish while riding my bike to work after waiting on hold for over an hour. As small business owners, we understand that uncertainty is part of the deal, but it should be uncertainty and risk from our industry, not our healthcare. We need to know that from year to year we'll be covered. Small businesses in St. Paul need a better solution. For Millie, the increasing cost of insulin and drug prices mean there's absolutely no way we can go without insurance. The cost of insulin has skyrocketed from about $60 a month to $600 to $1,000 a month for the same medicine. Another example of how privatized healthcare has failed our family. With the COVID pandemic challenging the finances of every small business in the city, now is the time for change. Now is the time to create stable and affordable health insurance that's not tied to employment. Let's move forward to universal health care, protecting those with pre-existing conditions and preserving the gains of the Affordable Care Act. Thank you very much.
Thank you, Mr. Marshall. Ms. Yang.
Thank you so much to both of you, our special guest speakers who took time out of your schedule to be here. You all shared really, really moving and powerful lived experiences that reflect so much of the pain and struggle that people across our city, our state, our nation are experiencing. And it's evident through the many public comments that were submitted to the council. It's evident through the grassroots people's movement that we see in our country to push for the Minnesota Health Plan, Medicare for All, the Healthcare Emergency Guarantee Act, and I feel a simple core value that prioritizes people over profit, and that's affirming healthcare as a basic human need. And I wanted to share to the council here that, this resolution, I'm so proud to be able to share it and introduce it, and thank you to those of you who have co-sponsored it. To me, this is a really personal issue. There are a lot of reasons why I support it, but maybe first off, I should start at the values point. It really aligns with the type of future that I feel people deserve. We deserve to live in a community where everyone is in, no one is out, where people don't have to feel like their life is measured by money, by value, and that when they get hurt, they don't have to worry about whether a visit to the hospital or emergency room will actually bankrupt their family or leave them in debt. I think that living in a world centered around care is a type of world where, all people, a world that all people deserve. And this is such a big step in us being able to craft that. The second thing is that this is a really personal issue for me as well. Prior to being on the council, I worked at Take Action Minnesota, where this is one of the leading issues fought for by that organization. And I got a chance to really dig deep into my story around healthcare and why that was so important to me. And as somebody who grew up in a refugee family and also a low-income family as well, I remember how many times I would think about whether my family or even myself should make that visit to the hospital or to the clinic, and decided not to because I knew that it would cost a lot and that it would actually be a financial burden on my parents, who were already struggling to pay so many bills at the same time, especially during a recession, 10 to 15 years ago. And also, I'm reflecting a lot on the experience that I just went through recently when a family friend of mine and also a fellow Hmong sister of mine, Marnie Zhang, our school board chair, recently passed away. When she passed away, I was in so much grief. And for many, many days, I found myself just crying and, in tears and in so much pain for losing a loved one. And, there was a point where my body got so weak. My body got so weak to the point where I had an accident and I had a nosebleed that, happened for so long it wouldn't stop after 45 minutes. My brother had to take me to the emergency room. And I remember clearly moments where after I got my hospital bill, I thought to myself, I wonder if I should have made that visit. And I wonder how many families have to go through that same thing as well, because no one should ever have to consider that, before making such an important a stop to the hospital. They should be able to do that without having to have so much doubt about their own self-worth and being able to make that visit, and being able to just care for themselves. And the third thing is that I feel this is such an important step for our council to make, to really push and support something like this, because I was just really empowered by conversations with our nurses who talked about, through research, they found that city government would actually be saving so much more money as well, in terms of having in terms of Medicare for All being passed all throughout our nation. It would save costs, in terms of like healthcare benefits to employees, and we often talk about how in our city government, about, especially during this pandemic, about what our budget's going to be like, having, to live in this pandemic and having so many unexpected expenses as well. And our nurses, our frontline workers are clearly telling us this is the step that we need to make. It's the right step, that people need, that our government needs as well. And the last thing I wanted to mention too is that in the resolution there's clear language around having the council push for our legislators, our congressional delegation, to support a resolution like this as well, or to support these acts and these programs. And the reason why I feel this is so important is because we've seen over and over again how folks in elected office, whether it's at the state or national level, are not deeply aligned with what people all across the nation are demanding. And this is a call for all of them to do that, to actually commit to the work that they are in office to do, which is to listen to the folks of people, to center folks who are most deeply marginalized in our community, who are left out in policy And this is the answer that the step that we need, not just in St. Paul, not just in Minnesota, but all across the nation. And I feel in this moment we need leaders in elected office to step up and be courageous the most, and to be able to be willing to carry these radical issues, these important issues, to care for everyone all across our community. And so I support this resolution wholeheartedly, and ask you all to do that as well. And if you can also reflect deeply on any comments or reflections that you have from the stories we heard, and from the things that we are sharing today, I'd love to hear that as well. Thanks, everyone.
Thank you, Ms. Yang. And I do want to remind my colleagues that using Microsoft Teams, if you look at if you move your cursor over the screen, you can see a bar that shows the camera, the mute button, the share screen, and then there's a raise your hand button. And if you use that to indicate that you'd like to add some comments, that will help us. If you can't find it, go ahead and just use the unmute button, and that should get the job done. Ms. Prince.
Thanks to Councilmember Yang for bringing this forward. Thanks to the Minnesota Nurses Association and the Physicians for a National Health Plan and our speakers today. I'm so grateful to both of them. And Dan has been not only a good business owner, but Dan Marshall has been very active in working to make St. Paul the best city it can be. So I really appreciate hearing from him. If COVID has taught us anything about our healthcare system, it is how completely broken it is and how inadequate it is in serving the needs of our people. I reached out to Dr. Tom Kotke, who is working on homeless youth and family issues in St. Paul, and he said universal health care is important because it is humane, and ultimately it probably is going to turn out to be more efficient and less expensive than the system that we have. While I was researching this, after I talked to Councilmember Yang, I ran across a story that was completely horrifying to me, that one of our corporate CEOs in Minnesota, David Wickman, the CEO of United Health, and it was announced in April, after the start of COVID, coincidentally, that he made $52 million this year, up from $21 million in 2019. What human being is worth those rates of salaries? And I think we have to think in terms of how that money could better be spent by a public system of Medicare for all. I think about over the last many years of all the GoFundMe campaigns that I have been on to help people raise money to cover healthcare costs for cancer or for complications of a pregnancy. This is not the way our world should work, that CEOs make $52 million and people and regular people have to have GoFundMe campaigns to pay for serious health problems. So I thank Councilmember Yang, and while I don't fully understand all the details of how these plans would work, I trust the Physicians for a National Health Plan and the Minnesota Nurses Association to be guiding us toward the right programs to make this work for everyone. So thank you, Councilmember Yang.
Are there other comments? Mr. Tao?
Thank you, Council President. Thank you, Councilmember Yang, and the co-sponsor, all the partners and nurses that have put this together. As I was reading through this in Legistar, I thought about there's a couple of things in life that we can't escape. And I know we joked about paying taxes, but the real reality is that healthcare cost is something that we can't escape. It's something that we all have to go through. 70% of the Americans, they get sick before they pass. And so, our family has experienced this firsthand, and we, with Aiden and her medical experience with her bone marrow transplant, and we are fortunate to have healthcare from the city, but there are thousands of families in Minnesota that don't have access to good healthcare. And so Medicare for all, it's sometimes people take that for granted, but you don't, by the time you need it, it's already too late. By the time you need good health coverage, it's already too late. And so, we know for a fact that the healthcare system as it is today, it's like Councilmember Prince said, it's broken. It doesn't work. And we adapt, right? And so, for example, with COVID, we adapt how we work in the city, just like how we're having this meeting through Microsoft Teams. The healthcare system also needs to adapt to the needs of today, and that means healthcare for all. That means Medicare for all. And so, I'm happy and proud to support this resolution.
Thank you, Mr. Tao. Are there other comments? Looking at our mute buttons, Mr. Tolbert.
Yeah, I just want to thank Councilmember Yang for highlighting this issue. I think as Councilmember Prince mentioned, there's the specific proposals that are a part of this resolution are, very complex, and as we have no authority over them either because we're not at the state level or more importantly the federal level. We don't necessarily know all the complexities of them, but I think the most important thing, and the thing that we're highlighting here today, and the thing that this pandemic has truly, I think, highlighted, is how much more we need justice and fair and healthcare for everybody in society. It was a big step when Obamacare passed. It was a huge thing for America. But I think what this pandemic has highlighted is how difficult it is, especially when healthcare is tied to employment. And we see that particularly today where people are either furloughed, laid off, or could be switching jobs because of the result of this pandemic, and how important it is not to lose your health care during a pandemic. So I really appreciate the folks who have brought this forward and highlighted that we need a better plan nationally and at the state level. And thank you very much for doing that. Like I said, I am not a healthcare expert. I just know, and we see it, and when we talk to our constituents and we talk to people, is that we can do better, and we need better, and all people in this country do need better. So I'll be supporting this today. Thanks.
Thank you, Mr. Tolbert. Ms. Jalali.
Thank you. I have been really grateful for all the voices shared. Special shout out to Mischief Toy Store as a testifier and constituent. Dan, thank you for talking about that from a business owner perspective. And I think Medicare for All is an obvious and no-brainer policy solution. And the only reason it's controversial is because we have simply accepted a politics for too long in our country that what's best for the richest people can trickle down to the rest of us, and that having choice within that is actually good for the public. And it's not. The pandemic has exposed how we need to actually deeply, radically reorganize our society to meet people's basic needs, not nice to haves or dreams and aspirations, but basic needs. And this would represent a powerful statement from our local government to our federal delegation and to our community and where we stand. So I'm really thankful to Twin Cities DSA, Minnesota Nurses, all the different groups that helped organize to make this into reality. Thank you, Councilmember Yang, for bringing this forward to create an opportunity to talk about this. And I'll be voting in support today. This is something that, to me, shouldn't be controversial, and we need to start making and taking stands to show that it isn't, and that it's possible. So thanks to my colleagues for supporting too, and I join you today doing that.
And I stand in full agreement with the comments that I've heard my colleagues say. Nothing is more rationed about medical attention than when you have to decide whether or not you're going to go get a broken bone or an injury looked at because you're afraid you can't afford the bill. That is a shame in a country of our wealth and opportunity. It's a shame. I will just add to our conversation today that I will work with Ms. Yang's office to make sure that the points in this letter are codified into a letter to our federal delegation to make sure that this resolution doesn't just become part of a dusty collection of resolutions, but instead comes to life and makes our values known to our delegation as well. So I will also be in full support and appreciate the leadership of Ms. Yang in the coalition that she worked with to bring this forward. And so we have already approved a version 2, and I would take a motion then from Ms. Yang to approve the resolution in its final form. Roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The resolution is adopted. Item number 17, Resolution 20-1068, approving the mayor's appointment of Nicole Goodman to serve as the Director of the Department of Planning and Economic Development effective August 3rd.
Well, this is exciting. I think what we're going to do here today is we'll take a vote on this item, and then we'll do the swearing in. And then if folks have comments, maybe we'll follow that once we've finished the swearing in. So why don't we begin with a motion from Mr. Tolbert to approve this appointment. Any discussion on that motion? Seeing none, roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The resolution is adopted.
Yay. So it's so much more wonderful to do this in our council chambers, I have to tell you. But it's wonderful to have you here. If it's okay with you, I think what we'd like to do is swear you in, make it official, and then maybe if you could share a few words with us.
Absolutely.
All right, Ms. Moore.
All right, Nicole, if you raise your right hand and repeat after me. I, Nicole Goodman,
I, Nicole Goodman,
do solemnly swear
do solemnly swear
to support the constitutions
to support the constitutions
of the United States
of the United States
and of the state of Minnesota,
and of the state of Minnesota,
and to discharge faithfully
and to discharge faithfully
the duties devolving upon me
the duties devolving upon me
as the Director of the Planning and Economic Development Department
as the Director of the Planning and Economic Development Department
of the City of St. Paul,
of the City of St. Paul,
to the best of my judgment and ability.
to the best of my judgment and ability.
Congratulations.
Thank you.
Congratulations. Welcome to the City of St. Paul. We're so excited to have you here. I'll turn things over to you for a few moments if you'd like. And of course, we've got miles to go and lots to learn. And so I'm not trying to put you on the spot, but we're just so excited to have you here today. So we'd love to hear a little bit about what brought you to our wonderful city and what are you thinking?
Okay, thank you so much. Thank you, Council President and Council members. I am thrilled to be here. Today is my 3rd day on the job, so I'm still drinking from a fire hose. There was actually a fire on the 2nd day of my job, so so that was interesting. I am a new resident to St. Paul, but I'm not completely new here. My close family, including my dad and stepmom and my sister, have been in the Twin Cities for over 30 years. So I've been a frequent visitor my whole life, and also in my previous work in Oklahoma City, I have often looked to the City of St. Paul for examples of best practices in policy and in programs. So I'm truly honored to have been appointed and to be a member of this incredible leadership team. I will be reaching out to each of you to schedule time to get to know more about your boards and your priorities for the city. Quickly, I have just a moment. I would love to acknowledge and express appreciation for Kristen Guild, the Deputy Director of the department, who's been serving, as you know, as interim director for nearly a year, much of that time under very unusual and challenging circumstances. And I know she has done a wonderful job. She has been incredibly gracious and helpful as I have been transitioning into this position. So thank you to Kristen and thank you to all of you. I'm just so happy to be here and really looking forward to working with you.
Wonderful. Thank you so much. And I'm just looking to see if Mr. Tolbert, our chair of our HRA, has anything you'd like to add before we send you off to do more work on day 3.
Yeah, I just want to, Nicole, welcome you to the city of St. Paul. We are very excited to have you. You have quite the resume and great experience. And I know staff is also very excited, as well as the mayor's enthusiastic support for the appointment for you. As you're well aware, because we had a conversation about it this morning, we have your first HRA meeting, not our first. We've had many. Right. HRA meeting next week, and we look forward to having you there. And also, I want to second thanking Kristen Guild for her service over the last year. And I think, we can all take a lot of time at the next meeting to maybe recount all the stuff that it's been a long year, but a lot has happened in the last year. And, I look forward to working with you and Kristen as we move forward. There's a lot of exciting things going on in economic development across the city, as well as workforce and other things that the department you now lead will be involved in. And I know that each and every single one of us, I just know this from experience, you'll find out soon enough if you haven't seen, but we all care very deeply, not only about our ward, but the entire city. And so do the citizens of St. Paul. So we're excited to have you, and thanks for joining us. And more than anything, congratulations on today.
Thank you. Thank you.
Mr. Tao.
Thank you. Congratulations, Ms. Goodman, Director Goodman. I was expecting a heavier Southern drawl, from the. That's okay. St. Paul is at a very exciting time. Before COVID-19, St. Paul was booming, it was growing, and we are ready to take that next step. And I think you're that person. There's a lot of excitement going on in the Midway, the Forsyth, Hillcrest, and so we look forward to working with you. Our office is here to assist you, and our success is your success. So I look forward to working with you in the department. Thank you.
Thank you. Thank you so much. Thank you.
Wonderful. We will look forward to hearing from you in the coming weeks. And I'm going to ask the question that we're all dying to ask. Where do you live? Which ward are you in?
So I actually rented an apartment so that I could decide where I want to buy. So I'm currently on Grand in an apartment. Is that Ward 2? I don't have the ward map in front of me, actually.
Well, depending on where it is, but it sounds like you're up for grabs. So we should all be showing us our best foot forward.
I am up for grabs because I'm only in an apartment at this time. So make your pitches for where I should be looking.
Wonderful. Well, thanks again. Congratulations. It's wonderful to have you here. We all look forward to working with you in the years ahead of us. So thank you so much.
Absolutely. Thank you.
All right. Take care.
Thank you.
Item number 18, Resolution 20-962, approving the mayor's appointment of Matt Slavin to the St. Paul Port Authority.
And this item has been withdrawn. There is an email letter from the mayor in our inboxes explaining the withdrawal of this item.
Item number 19, Resolution Public Hearing 20-167, approving and authorizing the acceptance of a contamination cleanup and investigation grant from the state of Minnesota's Department of Employment and Economic Development, a Livable Communities Tax-Based Revitalization Account Grant, a Livable Communities Demonstration Account Pre-Development Grant, and a Livable Communities Trans-Oriented Pre-Development Grant, all from the Metropolitan Council and amending the 2020 budget.
All right. Are there I'm doing this today with the agenda on my computer screen as well as the meeting. So there's a lot going on. This is a public hearing. The item has been open for folks to make comments. This is an item where we're accepting money for important projects, and folks have been able to provide their public testimony. Is there any discussion on this item? I'm toggling back to our meeting. Oops. If you have discussion or comments on this before we close the public hearing, please chime in. All right, it looks like there is no discussion on this item, so Ms. Yang would move to, Ms. Prince.
It looks like we didn't get any public comment, is that right? On the agenda that I have, it doesn't indicate.
There's been no public comment submitted. The public hearing has been open for email and phone transcription. So Ms. Yang would move to close the public hearing and approve. Roll call.
Prince?
Aye.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Council President Bredmoen?
Aye.
6 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item number 20, Resolution Public Hearing 20-165, supporting the Rush Line Bus Rapid Transit Project 15% plans within the City of St. Paul.
All right, this is exciting. On this item, we do have a report from Commissioner Reinhardt from Ramsey County, and a staff member, I am not sure who is reporting with Ms. Reinhardt, but welcome, Chair of Rush Line Commission, Victoria Reinhardt. It's wonderful to have you and team from the Ramsey County here today.
Thank you. And I will be giving just a few opening comments, and it will be Frank Alarcon who is going to be going over the plans in more detail. So first of all, I am Victoria Reinhardt, Ramsey County Commissioner. I represent District 7 on the county board, which includes one precinct on the east side of St. Paul, the city of Maplewood, city of North St. Paul, and the city of White Bear Lake. And I am really thrilled to be here today to talk about this really important time in Rush Line at the 15% completion of the engineering. So thank you for the opportunity to report on this today and to really talk about the excitement behind Rush Line Bus Rapid Transit Project. It really will be a critical transportation investment in our region. The Rush Line will promote equity and prosperity in the East Metro by connecting people efficiently and affordably to jobs, education, healthcare, parks, and other necessities. We've reached that important milestone in the project with the completion of the 15% plans after over 2 years of extensive analysis and public engagement. The City of St. Paul and Ramsey County have been working in partnership throughout this process, and over half of the Rush Line's 21 stations are located within the City of St. Paul. It's truly, the City of St. Paul's partnership with us has been absolutely critical in moving this forward. I would also like to really thank Councilmember Yang for her role on the Rush Line Policy Advisory Committee and Council President Brenda Moen, who served in that capacity before her. Your input there and participation has been very important as we've moved forward, so thank you very much. So now I will turn it over to Frank Alarcon from Ramsey County Public Works, and he can provide a brief update on the project and the 15% plan. Thank you.
And Ms. Reinhardt, I just would like to say right back to you, thank you so much for your leadership on the Rush Line Commission. You have been at the helm since its infancy, driving this thing forward. I think you recruited me to join the Rush Line Commission, even though it barely touches Ward 5, but we know how important it is for St. Paul and the East Side. And so it's been a pleasure to serve with you. You are an amazing leader, and I really appreciate what you have done to bring this incredible project to fruition on the East Side. It's wonderful. And I know we still have miles to go, but we're getting closer every day. So thank you so much.
Thank you very much.
Great. Well, I'll take over then. Thank you, Commissioner Reinhardt and Council President Bredmoen. I do have some slides, so Ms. Moore, I'm wondering if you're able to share those on your screen. It looks like I don't have the ability to share my screen.
I can change your rights.
Oh, thank you. There we go. I see I have the ability now.
We just demoted you for a little while. You're back. There you go.
All right, let's see.
I was going to say, I think we full on lost him, but he's back. Welcome.
Oh, my apologies there. Let me try that again. There we go. Are you seeing my my slides there?
Yep, we sure can.
Excellent. I will put them here in full screen mode. Again, I'm Frank Alarcon. I'm a planner with Ramsey County Public Works. Thank you so much for having us today and considering this item at this key milestone in the planning process for the Rush Line Bus Rapid Transit project. I'm just going to share a little update about the project and jog your memory about some of the details of the project. And I'll also be happy to answer any questions you might have. I'm also joined by Jeannie Witzig from Kimley Horn, who is the head of the Rush Lines consultant team and an expert on environmental planning. She's also available to help with any questions from members of the City Council. So to just start with the basics, the Rush Line is about a 15-mile future bus rapid transit corridor starting in downtown St. Paul at Union Depot and extending north to downtown White Bear Lake. There are about 21 stations, or exactly 21 stations along that 15-mile corridor. 11 of those stations are within the city of St. Paul. Along the corridor, there are about 100,000 jobs within a short walk of a station. Many of those jobs are in the healthcare sector, so some of the major healthcare employers along the line are Regions Hospital, Gillette Children's, and St. John's. There are also a number of specialty clinics and other healthcare providers along the corridor. In addition to serving about 100,000 jobs, there are also about 100,000 residents within a short walk of the stations of very diverse backgrounds in terms of race, ethnicity, and income that will be connected to opportunities, to parks, to healthcare by this line. So just to kind of show the Rush Line in the regional context, this is a schematic image that Metro Transit put together showing the future vision of future rapid transit corridors. And the Rush Line is the purple corridor there in the top right-hand corner. As you can see, it really can serve as the spine for many neighborhoods on the east side of St. Paul and downtown and further north into the northeast metro, connecting that part of the metro to the regional transit system. Folks using the Rush Line are going to be able to transfer to other corridors in downtown St. Paul, like the Green Line, like the Gold Line, and really the line will help make the system integrated and connect that northeast quadrant of our region. So just a little bit more about bus rapid transit and what makes it distinct from other forms of transit. BRT is a premium bus-based form of transit service. Some of its distinctive qualities are it runs frequently all day long in both directions. So the Rush Line is expected to operate every 10 minutes during the PM and AM rush hours, and then throughout the day, every 15 minutes. So that allows riders to just show up at a station and know that there's going to be a bus. They don't necessarily need to check a schedule. The buses will be state-of-the-art, very likely to be electric buses. The stations will have a high level of amenity, so that includes things like shelter, seating, bike parking. The fare payment is done at the platform rather than on the bus, which makes the boarding process faster and more efficient. Also, the platforms will have raised curbs, which will allow people to more easily board the bus. Are we in the process? So currently, Ramsey County is leading the Rush Line project through its environmental analysis phase. What this phase entails is preparation of an environmental assessment, which is a document that examines any potential environmental impacts from the project. In order to assess the environmental impacts, the project needs to be engineered up to a certain level. So that's that preliminary engineering task that resulted in the 15% engineering plans that are included with the meeting packet today. Other key tasks of the current phase of work are preliminary station area planning. So that is a process that looks at biking and walking connections to stations to make sure that people can safely and easily walk and bike in order to access the transit station. It also looks at economic development opportunities to encourage housing, jobs, retail, and other uses near stations so that more people have access to transit and transit is more useful. And then all of this work is informed by extensive and ongoing engagement with the diverse communities along the Rush Line's route. Another huge component of this project is coordinating with our project partners. The City of St. Paul is one of our most important project partners, as about half the corridor is within the city, and we coordinate very extensively both at the staff level with both PED and Public Works, and also at the policymaker level. Councilmember Yang represents the city on the project's policy advisory committee, and previously Council President Bren Moen served in that role for years. So just a little bit more about public engagement. Since early 2017, we've conducted about 170 public engagement events. So that could be something like presenting to a district council, showing up at a community destination like Hmong Village in the photo to talk with folks. It could be having a table at a major community event to speak with people. Since COVID started, our engagement has been fully online through social media, surveys, email, and through all of this work, we've engaged thousands of folks of diverse backgrounds up and down the corridor. Just a few examples of the ways that feedback from St. Paul residents and businesses has actually influenced the designs of the project. One is adding a station at Cook Avenue, which is right across Phelan Boulevard from Hmong Village. Something we heard from folks at Hmong Village was that they want really easy access to this line. Other changes include refining the location of the station on Arcade Street to put it closer to where people go, and to put it in a better position to encourage economic development at that station location. Something we heard from businesses on Robert Street was that parking is really important to their businesses, and so we adjusted some of the designs on Robert Street in order to accommodate those concerns. And another item that involved a lot of public input and engagement was development of the Ramsey County Rail Right-of-Way Design Guide, which is a document that recommends design treatments for the portion of the project where the Rush Line guideway will be co-located with the Bruce Bento Regional Trail within the right-of-way that Ramsey County owns. Knowing that the Bruce Bento Regional Trail is a really important amenity for folks, both for transportation and recreation, Ramsey County is very committed to maintaining the Bruce Bento Regional Trail as an amenity going forward, even when there's bus rapid transit sharing that corridor. So just to zoom in on the route within St. Paul, the dots represent stations and the lines on the map represent the route. Purple represents areas where the bus operates in its own dedicated lane. So as you can see, most of the route in St. Paul is in dedicated right-of-way. What that means is that it's a more reliable trip than a typical bus, and it's also faster because it's not affected by traffic congestion.
Can I just interrupt you quick? I see Ms. Prince has her hand up, and I did want to add one comment on the slide that you, the previous slide. So I'll go to Ms.
Sure.
Prince quick. Ms. Prince?
Thank you, Council President Bren Moen. My question is, I just heard from a constituent whose family just bought a house that the backyard opens onto the Bruce Vento Trail. And of course, they're very concerned about the potential impact on their home value. The other issue is that there is a member of the family who is very ill, and so they're concerned about impacts on their home. And you don't have to get into any specific answers here, but I wondered if they live in the home is in Maplewood, so it probably is a question for it's probably a constituent of sorry about that, of our county commissioner Victoria Reinhardt. And but I'm just wondering if you can provide me, whether it's after this meeting or not, with a staff person who the family can talk to about the potential impacts of having the rush line go through. I think if it's electric, it will surely be quiet. And so I'm guessing that the impacts may not be what they expect them to be. But in any case, if we could connect after the meeting.
Absolutely, Council Member. We're happy to speak to that resident and address their concerns as best we can. Thank you for bringing that up.
I think it's important to point out that those impacts are also benefits in a lot of ways. Their property is now going to be connected to the bus rapid transit. There's been a lot of great planning that's gone involved there. So I think in addition to talking about how it may be negatively impacted, we can make sure that they're connected to the positive benefits of being on that route and the potential for it to increase their property value. I know that they've done a lot of work to keep the walking trail in place, and that was a very big part of the work as we went through the Vento Trail section. So hopefully we can make sure that they're connected to both. And I just wanted to, on the public engagement piece, I think that over the course of the project, the engagement really improved. The engagement became something that felt very intentional and authentic to me. One, I wanted to just lift up the adjustment of the Arcade Street Station location and routing for people who might not be familiar. On Arcade, the proposed stop was to be at an underpass where Phelan goes under Arcade Street. And there was a strong community voice, the business association and the district council, that said that people wouldn't wait, under the underpass and the bridge kind of out of sight lines, and would be maybe disinclined to use that stop. And also, as you mentioned, Frank, that we wouldn't gain the economic benefit of having that stop and go, the movement and at that site at Arcade and where it crosses Phelan. And so that change, moving it up to the top of the overpass as opposed to down in the kind of dark, shadowy part underneath, is a huge deal. And that really shows that these processes where we work from an initial proposal through all of the details to get to the best possible route are great opportunities for people who really know their community to weigh in and make a difference on what the final outcome is. And this particular one, the next time you drive down Phelan and go under Arcade, that's a good thing to kind of, it's a good example of how that public engagement really paid off, and it's going to make a big difference in that area. So thanks. I wanted to, when you look at it on paper, it's just like the underpass or the change. There was a change at Arcade, but it was a huge deal, and I commend everybody who took a part in making that change.
Thank you for that comment, Council President.
Council President Brendamon, I don't know how to raise my hand. Can you hear me?
You're in.
Okay, thank you. I just wanted to comment a little bit on the question from Councilmember Prince. From the very beginning, Rushline has made it an absolute that trail and rail will coexist, and we have worked very hard with the community on that plan. The other part is that it is very clear that this will be electric. Everything that we have, every indication that we have, and the timing of this I am very confident it will be electric, and you are correct that there is very little noise. And then also, I just wanted to say thank you to, I know there were a lot of people that were involved on the public engagement and the multitude of meetings that we had, a lot of elected officials. But I do know that Senator Fong He went out of his way to make sure that we had the Hmong community involved and to hear what they had to say as well. So I wanted to call out his work. And again, there were others, and believe me, we appreciate every elected official, appointed official, people that really work to bring people out to those meetings, because that's where you get the input, is when you get people there and offer them different opportunities to provide input through the electronic means or writing, or many different opportunities to provide that input. So thank you very much.
And we'll be able to connect your constituents with somebody who can talk to them in more detail, sounds like. So thank you for that follow-up. All right, let's roll.
Good. Just a couple more slides here. So the 15% plans are the subject of the resolution of support under consideration today. Just to kind of demystify what 15% plans are. So what at a 15% level of engineering, a transit project can basically do these things. The station locations are defined, so the plans in the agenda packet show where the station locations will be. They show the different transit guideway treatments up and down the route. So when I say guideway treatment, I mean, is it in mixed traffic? Is the bus in its own dedicated guideway, or is it running on outside lanes dedicated for buses? Other physical attributes that are identified in the 15% plans are traffic signals, bridges, underpasses. Also, as I mentioned, a big part of this project is improving biking and walking conditions in the immediate vicinity of stations. So the 15% plans include quite a few sidewalk improvements, for example, near stations. And they also identify potential locations where stormwater will be treated. And as part of that stormwater coordination, we work very closely with the different watershed districts up and down the line. And along the Phalen corridor, we work in close partnership with the Lower Phalen Creek Project, which is a community organization on the east side. So just to set expectations for what comes next, one common thread of what's going to happen in the next few years is that there will be ongoing coordination and involvement by the City of St. Paul and other project partners, including Minnesota Department of Transportation, Metro Transit, and the other cities. So the city will be involved every step of the way. The next big milestone to come is the publication of the environmental assessment for public comment that we're expecting in December of this year. A big milestone next year will be the transition of the project from being a Ramsey County-led project to being led by the Metropolitan Council / Metro Transit. So similar to other projects like the Gold Line, this project is being initiated by a county, and at a certain stage in planning, Metro Transit takes it over. When that transition occurs, it is anticipated that the project will be assigned a color. Like all the other transit corridors in the region, we are hoping for and expecting purple for the Rush Line, so we're excited about that. Leading up to construction between about 2021 and 2024, we will do final station area planning for the project, as well as finalize the engineering, preparing it for construction. The construction period is expected to last about 2 construction seasons, starting in 2024, concluding in 2026, with bus rapid transit service starting in 2026. So that's everything I have for you today. I am happy to answer any questions from the council at this time.
Great. Thank you so much for the update. Are there questions from the council? Ms. Yang. Oops. Ms. Yang, I know you're having some trouble with the mic today, but it looks like you're on mute.
Is it okay now?
Yep, there you go.
All right. I don't have any questions, but I just wanted to say thank you so much, Frank, to you and your colleagues. And I feel like we have such an incredible staff working on the Rush Line project here. I'm so deeply committed to community engagement and In the last meeting that I was in with our committee, I believe, Frank was sharing about a recent grant that they just received around doing more community engagement, especially in our marginalized communities. And so I'm just so excited about that work. And, during my 1.5-year campaign for City Council, transit was one of the biggest issues. And our Eastside community here envisions having a really robust transit system that connects them to other areas in St. Paul and other cities as well. And I feel like this is so aligned with it. And I know that this is just the beginning. There is so much more to do around public transit, and this is such a great step forward. So thank you all.
Wonderful. Other thoughts? All right, seeing none, I will mention again that the public hearing has taken place online, and Ms. Yang would move to close the public hearing and approve. Roll call.
Prince?
Aye.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Council President Brenmoen?
Aye.
6 in favor, none opposed. The public hearing is closed and the resolution is adopted.
Thank you very much.
Thank you very much
you.
for being here today and for your work. This is going to be great.
Thank you, Council President.
Item 21, Resolution Public Hearing 20-162. Considering and adopting the findings of fact, conclusions of law, and recommendation of the administrative law judge and request of the Department of Safety and Inspections for imposition of $1,000 matrix penalty against the liquor on sale 101 to 180 seats, liquor on sale Sunday, 2 a.m. closing, and entertainment B licenses held by Shua Tao, doing business as Papaya Thai Restaurant at 945 Rice Street.
Thank you, Ms. Moore. And I believe we're starting today with a staff report from Ms. Scarda.
That's correct. Can you hear me?
Yes, we sure can.
Perfect. Councilor Scott here on behalf of the Department of Safety and Inspections. This matter is before you to consider and adopt the findings of fact, conclusions of law, and recommendations of the administrative law judge and the request of the Department of Safety and Inspections for imposition of a $1,000 matrix penalty against the licenses mentioned by Ms. Moore for Papaya Thai Restaurant at 945 Rice Street. The licenses were the subject of a notice of violation and request for imposition of a $1,000 matrix penalty by the Department of Safety and Inspections for the City of St. Paul on December 2nd, 2019. The notice of violation alleged that the licensee violated license conditions and city ordinances by failing to provide copies of Minnesota Revenue Monthly Sales Tax filings for the entire 2018 calendar year, failing to provide sufficient information to verify that the establishment was operating within the definition of a restaurant, and failing to provide the Department of Safety and Inspections with copies of requested video. This was the second adverse action against the license in a 12-month period. The previous violation stemmed from a lapse in liquor liability coverage. The department was recommending the presumptive penalty of a $1,000 fine. As you may recall, the licensee responded to the notice of violation and appeared before council on January 15th, 2020. Some of the facts were disputed, so this matter was laid over and subsequently withdrawn to allow the licensee to dispute the facts. That hearing was held before an administrative law judge, and both the department and the licensee presented their cases. The notice of violation and exhibits presented to the administrative law judge are attached to the council file before you. On May 7th of 2020, the administrative law judge issued his findings of facts, conclusions of law, and a recommendation, and that is also attached to the council file. In sum, the ALJ found that the licensee violated the conditions when he failed to provide all of the surveillance video requested by the department. The ALJ found that the licensee violated the legislative code when he failed to provide the department with the information needed to demonstrate his compliance with license condition number 1. And the licensee found no substantial and compelling reasons to deviate from that presumptive penalty of $1,000. Therefore, it's the recommendation of the Department of Safety and Inspections that council adopt the ALJ's findings of fact, conclusions of law, and recommendation, and order that the $1,000 matrix penalty be imposed.
Great. Thank you, Ms. Skarda. Are there questions for Ms. Skarda? Okay, it doesn't look like we have questions. This is a public hearing, so we will hear from the business owner. And again, as you said, there was we sent it back so that they could be tried before the administrative law judge, and this is the findings that came out of that ALJ hearing. Is that correct, Ms. Skarda?
Council President Brenmo, that is correct.
All right, thank you so much. All right, so seeing no questions, we will move on to Kevin Chuatao to present his perspective on this item. I believe he is on the line, or we're bringing him on the line right now.
Mr. Kevin Chuatao is on the line, ready to go.
All right, welcome. Thank you for being here today. If you could just share your perspective briefly on this item. We have been briefed, and I do believe that we have had a conversation in the council chamber previously about this matter. So welcome. Thank you for being here today.
Thank you very much, Council President. Such an honor to be here today again. Council President and council members, this matter should have been done instead of for the first time that I sent my letter to Ms. Sakata that I do not choose to contest the case and admit to the fact and will let the decision based on whatever it comes up to the council members to decide whether I have to pay the fine in full, half, or in twice. It was Ms. Sakata's fault. She failed to appear on the first public hearing that make this complicated. Going through a couple of times, wasting your time, my time, the law judge's time. She withdrew the case from the second time that she appeared on the second time. And I believe that you, Council President, was not agree to what she trying to withdraw the case from the fact that I admit to the fact and let the decision based on whatever circumstance to the council meeting to an ALJ case. I heard, and I believe that everybody heard you told her that this is not a good day for you to do Mrs. Carter. But she insists that she probably withdraw the case. She probably to the hallway, tried to convince me to go to the ALJ case with the public hearing or law judge, which is I'm not ready for that. I heard from the other two council members opposing the procedure. They stated based on the business owner whose language is not English, that should not be the case, and that's not good to be the case. But she all trying to do is to try to get me out of the regular public hearing to the ALJ, trying to find any proof and evidence to make me guilty of this, which is, I believe, I'm not guilty of operating anything besides that the insufficient surveillance video and the text, which is I provide to them, but not enough as they request. They got the video, Council President and all council members. They got the text report. That doesn't mean they did not get anything that they asked from me. They got something, but not as to what they request. And I don't see that I didn't have any guilty of that. I try to make them, send them back what I'm missing. And yeah, we went to the law judge hearing for half of the day. The judge did not come up with any decision besides just recommendation and drove the decision back to the city council members again. And here is nothing finding that I was wrong or guilty of the case. And now it is bad time for me because my restaurant has been closed since March 16th until now, and I won't be able to open any days or make any sales or do anything. Besides, I still have to pay the rent, $6,300 per month for the last 4 free and empty months for $25,000 total. I'm out of business. I'm out of income. That's the only source of income that I have. Both my wife and I working at the restaurant. We are both now unemployed. We don't have any income. Raising 8 kids, 2 adults, 10 family members in the family, which is a very, very bad time for me. I applied for Central Bridge Fund for this small business. I got denied. I applied for Ramsey County small business funding. I still don't get anything. They said it's still in the process. And the chance I will get any fund to help me will still in the air. Council President and council members, I am in a struggle raising 8 kids right now. And I don't think that this is a good time for me to pay the $1,000. The fact that Ms. Carter did not follow her role on the very first time to get these things settled when I was still able to pay either half or full. She delays the process until up now. It is very bad time for me, or I believe for everybody. So I don't think that is necessary. But the decision is still based on what all of you think about kids. That I should either pay in full, half, choice, or whatever. I'm willing to do that. I'm willing to take that. And I will go move forward. Council President and all council members. Thank you very much.
Thank you very much, sir. Sir, anyone else here on this public hearing? I believe it is just Kevin. All right. Mr. Tao would move to close the public hearing. Roll call.
Prince?
Aye.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Council President Brenmoen?
Aye.
6 in favor, no one opposed. The public hearing is closed.
Mr. Tao.
Thank you, Council President. When this came before the council, one of my concern was language barrier and the processing, and we come to a point where the business is no longer operating because of COVID, and so, but it is the facts is not disputed. And so I'm just curious if, because he's no longer in business at this time, is there any way that we can furlong the payment, and maybe until the business is operating again, and we can request for that penalty? I'd love to hear from my colleague, see if that's something that you all can support.
Mr. Tao, just to clarify then, you're saying to sustain the penalty but stay payment until a future date, like 12 months from now, or did I just want to make sure I'm hearing you correctly?
I think so, because there's hardship across the city for our business, especially bar and restaurant, and he hadn't been operating since this case has been brought forward to us. And so, and he also mentioned that he applied for the bridge loan and the bridge fund, and also for support from the county, and did not receive any. And so I think that we should try to be flexible and allow him to get back into his business. And at that point, we can execute the penalty.
All right. So stay the fine for 12 months.
Based on some of the economic forecasts, I think 12 months is doable with this, with the COVID-19 and what's going on with the economy. So I would move was it 12 month, Council President? 12 months?
Yeah, that sounds good. I just want to make sure that who's ever tracking on the notes can make sure that they put in the appropriate amount of dates. And I would just say that my hope, I know that Ramsey County's Small Business Assistance Fund, and I think I heard Kevin say this as well, is that they are still processing their application. So we'll be hopeful that some money comes the way. We were very oversubscribed with the St. Paul Bridge Fund, but I know that the Ramsey County Fund still has some funds available. So we'll hope that we can get some of those resources sent our way as well. And I would support your motion of suspending the payment for 12 months, as you suggested. Other comments? Ms. Prince.
I distinctly remember this case. I was very concerned about the language issues and the license holders' obvious confusion about the process. I also felt that when we sent it back to the ALJ, that was not what he was seeking, that he was seeking consideration of the penalty, but somehow we got into kind of a roundabout conversation where I think the wrong outcome occurred. I regret that he had to spend a half a day in an ALJ hearing, and that's an expensive hearing for the city to have to be funding. So I think we made a pretty big mistake there. Given the hardship, I would support reducing the penalty to 500 and staying it until his business is reopened, or whatever the decision is here of 12 months. I feel that this is a case that really, through no fault of anybody trying to do the right thing, I think the wrong thing happened because of confusion and language issues. So that's my I support your motion, but I would, as you often suggest, that I'd make a friendly amendment to reduce it to 500.
I see Ms. Scarda has her hand up, and Ms. Palmer as well. Can we hear from our city attorney's office? Ms. Scarda and then Ms. Palmer, or?
Sorry, I'm on mute.
Okay.
So there's two pieces here. First, we have to look at the findings of the ALJ and decide whether they're going to be adopted or amended. The licensee was offered interpreter services by the ALJ, and the licensee did put on a case before the ALJ. So to alter the findings, which include no substantial reasons to deviate from the presumptive penalty, we have to go back into the findings of the ALJ and find some fault with what the ALJ had.
You're not for delaying the payment, but for changing what the recommendation is from the ALJ, just to clarify, Ms. Okay.
Council President Brenneman, that's correct.
Thank you. Okay, I'm sorry I interrupted you. Did you have more?
Just that there should be two parts to the motion. I wanted to be clear. One is to adopt or not adopt and change. And then the other is, you know, if you're going to stay it for 12 months, that's an amendment I can make to the resolution after the hearing. If it's changing the amount, we have to go back into the findings.
All right, thank you, Ms. Scarda. And then Ms. Palmer, did you also, was that what you were going to say?
Essentially, yes. The license holder did appear at a hearing in which he was going to dispute the penalty, but began to argue the facts. And so at that point, determination was made to send him to the ALJ, whereas Ms. Scarda said he was offered the service of interpreter. And in order to deviate in terms of fine, you would have to have written findings that there is substantial compelling reasons making it more appropriate to lower the fine. And there's basis presumably in the ALJ report because there's was not actually his request. B, there is not an issue with staying the fine and then after can be taken without any written findings. It would be in writing, obviously, in the resolution, but you wouldn't have to find substantial and compelling reasons to stay it.
Thank you, Ms. Palmer. Ms. Prince.
And could we use hardship as a compelling reason to reduce the fine?
You asked to change the finding of the ALJ, so you'll have to find discrepancies in the findings of the ALJ who was not accurate and did not find hardship. I don't think you have a basis for the written findings necessary.
Okay, well, then I guess I don't have enough familiarity with the findings at this point to be able to substantiate that. So I guess I'll withdraw my friendly amendment.
Thank you, Ms. Prince. Mr. Tao has moved to adopt the findings of the ALJ and stay the penalty for 12 months for payment. Is there discussion on that motion? All right. Seeing none, we will go to roll call.
Prince.
Aye.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The resolution is adopted to adopt the findings of fact, conclusions of law, recommendations of the administrative law judge, and to stay the penalty for 12 months. Item 22, resolution public hearing 20-160, approving adverse action against the auto body repair garage and secondhand dealer license application held by A&M Auto Sales, Inc., doing business as A&M Auto Sales at 845 Roberts Street.
And I believe we would like to, this is a public hearing, so, and there have been opportunities for the public to submit their testimony online, but because it's been noticed, this is the public hearing, I would propose that we hold open, what is the term?
Continue the public
hearing and lay the matter over till August 12th, given that Ms. Naker is not in attendance today. Is there discussion on that motion? Seeing none, roll call.
Prince.
Aye.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The public hearing is continued to August 12th. Item number 23 is being withdrawn. The license is no longer needed. Item 24, ABZA 20-4, considering the appeal of Justin Eilers to a Common Bond Communities to a decision of the Board of Zoning Appeals to deny a variance request of the open space lot coverage requirement at 830 Cretin Avenue.
All right, and do we have a staff report on this item?
Yes, Tia Anderson, she's on the line.
Okay, and Tia, I just upgraded you to presenter. Welcome, it's wonderful to have you here.
Thank you. Now, so long as I can, as we change platforms here today, let's make sure I can actually figure out how to present.
There you go.
All right.
Let's try.
Yes, perfect. Good afternoon, everyone. My name is Tia Anderson. I'm in the Department of Safety and Inspections. I'm the principal planner there, and I am representing DSI zoning staff in the variance appeal for 830 Cretin Avenue by Common Bond Communities. So I met with council a couple of weeks ago on another appeal of a BZA decision within the Highland Bridge Ford site. And much of the material that I have presented today is somewhat of a repeat of that presentation a couple of weeks ago, but do want to just sort of orient folks to where we have been with the Ford site Highland Bridge development process. And so over a decade ago, city staff and others began and completed a significant planning and community engagement effort around the former Ford Motor site. Then in the last few years, things have sped up significantly. So back in 2017, the city adopted a public realm master plan and zoning study. And then since 2018, when Ryan Companies was named as the master developer, we have, as a city, signed a redevelopment agreement with Ryan Companies, and now this year have begun in earnest on that site preparation and public infrastructure work. And here we are with our first affordable housing development, getting everything in line to begin its development at 830 Cretin Avenue. So 830 Cretin Avenue is the future where Cretin Avenue will come through into the Highland Bridge site. It is on Block 3, Lot 2, so the southern end of the block. It is a F5 business mixed zoning district, and it is surrounded, or will be surrounded someday, by civic spaces to the west in terms of the Civic Square and Civic Plaza, as well as another mixed-use property immediately to the west and to the north as well, and then existing commercial uses to the east. And then planned as part of the redevelopment will be future multifamily residential to the south in the F4 zoning district. This particular parcel also adjoins Outlot A, which we spoke about a couple of weeks ago. This is a private alley with that will provide access to this Block 3, Lot 2 project, as well as the proposed mixed-use development to the north. So just as way of background, the F5 business district, which is kind of this northeast corner of the larger Highland Bridge site, it is primarily an area with that will see commercial and other business uses, but it also does allow for this sort of residential affordable housing project. And it's really characterized by buildings that are built up to the public right-of-way that provide dynamic ground floor activity and provides an attractive facade that enlivens the public realm. So the proposed development for Common Bond is at the corner of what will be Cretin Avenue and Boland Avenue. And so in the aerial view here, you can see Cretin Avenue coming south off of Ford Parkway and Boland Avenue to the east. And so it's the, like I said, the southern end of Block 3. And then the more zoomed in renderings, the top one looking down Boland to the east, and the bottom one here looking up Cretin Avenue to the north. And you can see the mixed use development that is being proposed north of this site, also in this rendering. The project as proposed is a 5-story senior affordable housing development. There will be 60 residential units at 30% AMI. The ground floor will have a number of community spaces and common areas. There will be parking spaces, 29 parking spaces that are both a mix of structured, tucked under the building at the ground level, as well as 18 surface parking spaces that are accessed through that private alley outlot. The project is also providing 2 electric vehicle ready spaces, and there will be bicycle parking both in a bike storage room interior to the site, as well as a couple of exterior bicycle parking spaces. So this project went to the Board of Zoning Appeals at the end of June, and there were two variances that were applied for. One was for a parking setback along the interior property line of that surface parking area that was granted. The other variance, which was denied and is before you today upon appeal, is for minimum of 25% open space on that parcel, and 16% is currently what was proposed and denied by the BZA. It is worth just kind of noting here that there were a number of letters received by the BZA and subsequently included in the City Council packet, as well as additional 60 letters that were provided to Council. I think because of somewhat the timing of this project at the BZA at the same hearing as the other development on Block 3 for the mixed-use development, there were a number of letters that were received in opposition. Really, it was only about a third at the BZA and about 20% here that were submitted with City Council testimony that were really specific to the Common Bond site and specifically to this open space lot coverage variance. I think the vast majority of the letters were sort of broadly about the Ford site, or more specifically about the mixed-use parcel to the north of this. It was just very complicated for staff within DSI as well as the city clerk's office to kind of parse out people's intention in terms of providing that testimony. And so the conservative approach was to provide all of it to the BZA and to yourselves. In terms of this open space lot coverage variance, in the Ford site master plan, there is a requirement for private parcels to provide open space on that parcel. And that open space lot coverage is a new requirement for the city. It's not found in other zoning districts, and it includes landscaping, patios, and walkways that you would typically find on a development site. It excludes parking and drive aisles, however. And this particular open space lot coverage requirement is separate and distinct from the overall public park and open spaces that are dedicated through the redevelopment agreement and the master plan and the plat on the site. So this open space lot coverage variance does not detract from those broader public spaces that are dedicated throughout the site. The BZA, in its review, has 6 findings that it looks at. It denied this variance based on finding number 3, indicating that there were no practical difficulties in complying with the open space lot coverage variance. So the appeal that's before you today is based on the applicant indicating that there actually are practical difficulties in complying with that minimum open space lot coverage variance, that there are practical difficulties in complying with minimum open space lot coverage, and that the use of the property as proposed is reasonable. So there is existing bedrock on this site, and the slope of the site does create practical difficulties in moving the parking underground. The slope goes from east to west. And so if there were alternative site layouts, so whether that would be parking accessed off of Cretin or Boland, or a different building footprint, or some other configuration, ultimately that would result in another compromise, whether that be less residential units or less parking or less ground level amenity spaces, something that would probably create a variance of a different sort. And so the Common Bond project team has indicated that really all of these master plan and zoning districts, it comprises a multiple overlapping requirements that need to be coordinated, whether that's off-street parking, the ground level uses, orienting our buildings to the right-of-way with minimum setbacks, the lot coverage for the building, as well as the lot coverage for the open space, as well as managing the amount of impervious area that's allowed for stormwater management. That coordination of those multiple overlapping requirements, all of which are being met except for the open space coverage variance coverage, creates a practical difficulty for this parcel. And that the configuration as it is proposed is a reasonable use of the lot that could not otherwise be achieved without that open space variance. It's worth noting that since the BZA appeal, which was to request a 9% variance, so they're providing 16% open space surrounding the parcel. Through the site plan process, I've been working with the project team to have other conditions on the site that need to be met, such as their landscaping requirements for trees within the parking area. And so an exhibit that's included here from the site plan does indicate that as the trees are added into the parking lot area, that will increase the amount of green space that is in the project. However, it won't close the gap completely for this minimum open space requirement. And so what's before you today is still a appeal of the BZA's denial of the providing 16% open space, but knowing that it'll be likely something less than that as I continue to work through the site plan, providing that additional tree coverage around the site. So I just wanted to add that as well. Is there any questions?
I'm looking to see if there are questions from council members at this time. Ms. Prince.
Yeah, Ms. Anderson, I'm just curious, what was the vote of the BZA on this?
The vote was, and I can pull up the resolution specifically, I think it was 5 opposed to the variance and 1 in support. It was, I'll have to look for sure. It was 5 or 6 in opposition and 1 in support.
Thank you.
Mr. Tolbert.
I don't have questions. I just have comments on it.
Okay. Are there anyone else has questions? All right, Mr. Tolbert.
Yeah, first I just want to thank T. Anderson again for the very nice presentation. It put some of this very complex zoning stuff in a very simplistic manner and helped me understand it. I guess do we need to close the public hearing? Maybe I'll make a motion to close the public hearing.
All right, Mr. Tolbert, and folks can see the attachments in Legistar on this item. The public hearing has been open to public. And so Mr. Tolbert moves to close the public hearing. Roll call.
Prince?
Aye.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Council President Bradmoen?
Aye.
6 in favor, no one opposed. The public hearing is closed.
Mr. Tolbert.
Yeah, as I was saying, I appreciate the thorough presentation. I also appreciate the thought that the BZA put in, as well as many of the neighbors who and interested people who wrote in regarding this matter. I have been able to look at the information and read the comments, and I would like to make a motion. The BZA denial was based on finding number 3, which was the applicant has established that there were practical difficulties in complying with the provision that the property owner proposes to use the property in a reasonable manner not permitted by the provision. I find that the BZA erred in their decision because the appellant has met finding 3 and agree with the reasonable basis that was established in the BZA staff report on June 18th, 2020 that recommended approval of the appellant's variance applications. The practical difficulties that exist in complying with the open space lot coverage requirement in the master plan include, but are not limited to, existing bedrock under the site, multiple layers of density requirements in the Ford master plan, and that this site and it should be noted that this site plan complies with FAR requirements and meets the maximum building lot coverage requirements, and that changing the access point to increase the lot coverage open space would result in needing new and additional variances. I therefore make a motion to grant the appellate's appeal for the reasons that I just stated, as well as the reasons set forth under finding number 3 in the BZA staff report on June 18th, 2020, and to incorporate them into the BZA resolution number 20-038888. That's the motion I'm going to make, and just a couple additional comments regarding just in a general sense. One, and Ms. Anderson, I think, articulated this very well. I think there has been some confusion with the term open space. It might not be the best. I think people often think that it's lowering the parkland on the site or the additional civic square type park space and open space, and or the open space around the water feature, and that's not correct. It's regarding the open space and or landscaping around the outside of this building. So I just want to make that clear because I think there's a misconception there. And the second more general thing is I also want to take a moment now, because it's before this council based on a different matter, but that we're also on the cusp of delivering on our first affordable housing project, and that's this. And last week we had a market rate project that came before the council couple weeks ago for appeal, but this is also an exciting moment to stop and celebrate that we are on the cusp of the first affordable housing project and delivering on that and delivering towards that economic diversity that we all strove for in our master plan, as well as the master development agreement that we all passed. So that's also an exciting thing, and we have a great affordable housing developer as part of that project. So those things are obviously separate from the BZA appeal, but I will reassert my motion to grant the appellate's appeal for the reasons I stated in my previous comments.
Thank you, Mr. Tolbert. And I put this in the chat box, but can we please take down the, thank you. Just helps get a sense of who's ready to speak. Ms. Prince.
I'm sure that Mr. Tolbert will be surprised when I say I will vote to support the motion. I agree that Carmen Bond made a very compelling case for the practical difficulties that are involved. And additionally, you know, when you look at the practical difficulties, that the only way to get around the variance would be to reduce units or to reduce parking. Those do not seem like good options. So I appreciate the work done by everyone on this. I'm also excited about this project being 30% affordable. It's a miracle, and it's just great news. And finally, I just want to say about Ford, one thing that is concerning me as we move forward is that we are seeing variance after variance after variance on these projects coming forward, and I think, you know, if variances are supposed to be exceptions, and we shouldn't have to be granting variances to our master plan for every project. So it's something that we might want to look at in terms of if changes are necessary to the master plan, because going through these appeals is difficult, expensive, and time consuming. So I just want to suggest that, you know, as we go forward, that we figure out what's going on when so many variances are needed to the master plan.
All right. I'm looking to see if there's other comments, and I guess I would just, on Ms. Prince, on your comment, I'm imagining that in a 122-acre site with so much construction that we will continue to see a significant number of variances and amendments. It's a gigantic undertaking. When we went out to do the groundbreaking, I was just very taken by what an enormous project it is. So, but in agreement, I would say it would be good to have an efficient system to tackle those appeals and requests for variances, et cetera, as they come through, because I will be expecting them. But I also don't think it's necessary to go to great expense to handle each and every deviation that comes our way. We want to conform to the master plan, but I think that the scale of this is just going to, bring us a significant amount of requests for change. It just seems, if you think about one project, one building that will come to us for a variance, and then just the scale, to me, it's expected. So I guess I would second the idea of trying to figure out a process for which to handle these in an efficient manner. Other thoughts or questions on this item? All right. So Mr. Tolbert has moved to, this is always when it gets confusing when it's backwards. So you're to approve the variance or to accept the appeal.
To grant the appellate's appeal.
To grant the appeal. All right. To grant the appellant's appeal. Roll call.
Prince.
Aye.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The motion of intent is the appeal is granted. For the following cases, no objections to the legislative hearing officer's recommendations were received, and therefore she recommends adoption for the following items. Item 26, RLH RR 20-25, 412 Goodrich Avenue. Item 27, RLH TA 20-524. That just appears to be a vacant building registration fees. Item 28, RLH SAO 20-9, 873 Hawthorne Avenue East. Item 29, RLH VO 20-26, 1007 Hawthorne Avenue East. Item 30, RLH RR 20-8, 412 Holly Avenue. Item 31, RLH FCO 20-66, 1814 Marshall Avenue. Item 32, RLH VO 20-27, 1011 Minnehaha Avenue East. Item 33, RLH CO 20-9, 272 Richmond Street. And item 34, RLH VO 20-28, 390 Sims Avenue. And again, the motion would be to adopt.
So moved by Ms. Yang. Any discussion on that motion? Seeing none, roll call.
Prince.
Aye.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Aye.
Jalali.
Yes.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The public hearings are closed and the resolutions are adopted. For the following case, no objections to the legislative hearing officer's amended recommendations were received, and therefore she recommends amendment and adoption for item 25, RLH TA 19-932, 1418 Galtier Street. The motion is to adopt as amended.
So moved by Ms. Yang. Any discussion on that motion? Seeing none, roll call.
Prince.
Aye.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Aye.
Jalali.
Aye.
Council President Brenmoen.
Aye.
6 in favor, no one opposed. The public hearing is closed and the resolution is adopted as amended.
And this brings us to the end of our agenda.
Mm-hmm.
Wonderful. Before we adjourn today, is there news from the wards or news from the city that folks would like to share? I'm looking at the buttons. I will just, Ms. Prince. Ms. Prince?
This mute button is really giving me a, sorry about that. On Monday, Ramsey County and our St. Paul Public Libraries opened the community career labs at Dayton's Bluff, Rondo, Rice Street, and Sunray Libraries. And we get just tremendous media coverage. It's a great partnership because it's $15 million of CARES Act money that the county got. And they're partnering with us to use that money to help people in our neighborhoods of greatest need develop job skills, have technology access, and find jobs. So it's a really exciting partnership. I have one other bit of good news on, it's in September, so I think I'm going to hold off on that.
Okay.
That's off.
All right. Thank you, Ms. Prince. Ms. Jalali.
Thank you. So I think I did the thing where I clicked right out of the information before I meant to do it. So as I try to find it, so the Mapping Prejudice project has made a lot of impact with community research over the last year because it's uncovering the legacy of exclusionary and racist redlining and redlining practices through zoning and also through restrictive racial covenants. So looking at deeds across Hennepin County and most recently Ramsey County to figure out where it was literally written into the law that Black people and other people of color could not live or buy homes in certain communities. And this has been really important to reckon with. Tomorrow, there's going to be an update on the work underway to do mapping in Ramsey County. The webinar is at 12:30 p.m. tomorrow, and it's called A Reckoning with Race, the Mapping Prejudice Project, and it will just be a conversation with Mapping Prejudice and all the volunteers and people that have stepped up to continue the work and share what's been learned so far. This is a long-running effort across the two counties, and so look up Mapping Prejudice. The webinar is tomorrow, and I believe it's at 12:30 p.m., but I'm hoping to attend if I can make some of it to learn more. I think it's important history to grapple with and take those lessons directly into the work we do. So that's my plug for today.
And thanks for that invitation. And several times today, I've pointed out that we have these opportunities that normally with a schedule that we keep is hard to be able to pop into these meetings. And I think these reminders of opportunities to take part in these important questions or important conversations remotely is a wonderful opportunity to dig in where maybe it would have been more challenging pre-COVID. So trying to find the silver lining in COVID here. I do have a little bit of good news that I want to share, and this is from Ward 4. People often think that Como Zoo and Conservatory is in Ward 5, but it's in Ward 4. So I'm going to borrow from my neighbor, Ms. Jalali, and just remind people that Como Zoo and Conservatory is at long last open again, although you need to make a reservation. They're taking distancing very seriously, and so you'll have to make a reservation. If you go to comozooconservatory.org online, there's an easy online way to make that reservation. And then also there are other resources like Camp in a Box for parents who are running out of ideas for things to do with their kids, and to do digital learning and digital engagement during COVID. But it is so take a look at the page comozooconservatory.org, but just hooray, the zoo is open again for people who are looking for something to do that is safely distanced. And of course, a wonderful way to spend time with your family. I'm looking to see if anyone else has news to share. I see Mitra's hand is still up, but I think it's a carryover. Nope. All right, wonderful. Well, since there is nothing else to come before us today, then we will be adjourned. Thank you much.